All right, well, hi everyone, and welcome to this video presentation. In this video, what we're going to do is cover some kind of high-level results of a study that the Whitburn Center for Governance and Policy Research recently did, and we'll tell you a little bit more about the partnerships in a moment. But the title of this presentation, which comes from a report by the same name, is an evaluation of the Go Transit City Bus Program for K-12 students in Oshkosh. So I want to just quickly give a little bit of credit to all of the people that came together to make this project possible. So this project was funded by a Wisconsin Department of Health Services grant that was awarded to the Winnebago County Health Department. A portion of that funding was provided to the Whitburn Center. And so members of the Whitburn Center team included myself, Sam Larson, also Beth Boucher, who served as the graduate research assistant and internship supervisor. Jules Baniag and Adrian Hanrahan were research specialists working with the Whitburn Center. And then the Winnebago County Health Department, Ashley and Sarah Jean were staff who really coordinated this grant and brought us on board to do this evaluation piece. And then we also had two students from UW Oshkosh who worked with the health department, but also very closely with the Whitburn Center team. And that includes Priscilla and Maya down at the bottom there. I also briefly just want to say thank you and acknowledge all of the work of a student transit stakeholder team that came together to really inform the research design and the study that we're about to present to you. So I won't go through exactly all names and all organizational affiliations, but Adam Belcarelli, Lindsay Clark, Julie Conrad, Deb Martin, Kevin Miller, Katie Olson, and Don Shimura all contributed a lot of time and effort and energy to this project. So we just want to thank them as well. We are very grateful. I also want to acknowledge, they're not on here, but staff from the City of Oshkosh Go Transit department who were really helpful in providing a lot of information and background and access for our research team to do this project. So to briefly talk about kind of the background of student transit in Oshkosh, we'd like to share just briefly going back to 2013. So at that time, there were a number of people that came together and talked about this lack of affordable transportation, which is really this kind of key issue for many elementary, middle, and high school students in Oshkosh. So over a number of years, a number of local community groups, families, and students came together to advocate for a no-cost transit option for students through the Go Transit City Bus Program. In February of 2020, the City of Oshkosh, the Oshkosh Area School District, and private funders approved a pilot program that would provide rides to public and private K-12 students in Oshkosh free of charge. Here we want to share, and I know you can't quite see past my video, but what the results of this pilot program have been in terms of student ridership. So this chart shows from the beginning of 2020 through the end of 2022, there's been substantial growth since its inception. Because of COVID-19, of course, we can understand that student ridership was very low in the beginning months of 2020. So from January through August of 2020, only 113 rides were actually provided to K-12 students. However, you'll see when classes really started up in September of 2020, 2,428 rides were given in that month alone. So things really started up really strongly in the fall of 2020. For that entire year, you'll see over on the left-hand side of the screen, 7,688 rides were given to students. That just expanded in a overwhelming way, kind of beyond the imagination of what the original developers of this program even thought. So in 2021, just under 87,000 rides were given to K-12 students. And in the year 2022, that went up to 142,814 rides to students in that year alone. So despite that slow start in 2020, Go Transit has really become an effective and increasingly popular means of transportation for K-12 students in Oshkosh. Coming forward to the purpose and scope of this research project in relation to the Go Transit City Bus pilot program, we really sought out to understand and qualitatively assess. So we underline qualitatively how the Go Transit City Bus pilot program has impacted students and their parents and caretakers. And a key part of this I want to highlight is that grant that I originally mentioned that the Winnebago County Health Department received was to utilize qualitative methods. So using both open-ended surveys where we're asking kind of open-ended questions to folks, and then conducting focus groups to really go beyond the numbers and get a sense of the stories of both students and their families, parents and caretakers, to understand how they have been impacted by this program. It's also really important to mention that we utilize this community-based participatory research approach, kind of a mouthful there, for short CBPR, which really, again, involves working together with a number of community stakeholders. So we had a team of stakeholders. I mentioned these folks in the beginning, but that came from the Oshkosh Area School District, the East Central Wisconsin Regional Planning Commission, Esther, which is an interfaith social justice nonprofit organization, and then the Boys and Girls Club of Oshkosh. I also mentioned previously, but Go Transit administrators were key partners on this. They provided a lot of background information about the pilot program. They provided that ridership data that I just showed you. And then again, they assisted with access to the city buses, where we actually had a team of researchers go out and ride the buses to collect surveys from students throughout the spring in February and March. And at this point, I'm going to hand it over to Beth Boucher to walk us through the data collection for this project.
So the stakeholder team collectively developed 2 sets of survey questions. We had one set of questions for students in grades 6 through 12 who have ridden the Go Transit City Bus, and then another one for parents and caretakers of K through 12 students who have ridden the city bus. Survey distribution consisted of multiple approaches, including riding city buses, collecting field surveys from students, disseminating surveys to students by Oshkosh Area School District staff, a message from the OASD through the parent portal, Whitburn County Health Department social media invitations, and stakeholders were surveying at the Oshkosh Farmers Market. And so we had a total of 117 student surveys and 114 parent and caretaker surveys that were collected. Students from all public middle and high schools participated in the surveys except for South Park Middle School. The proportion of respondents include 1% from Carl Traeger Middle School, 22% from Merrill Middle School, 26% from Oshkosh North High School, 17% from Oshkosh West High School, 2% from Perry Tippler Middle School, 12% from Riverside at Fox Valley Tech, and 20% from Webster Stanley Middle School. Parent and caretakers of student riders that took the survey represented all schools in the Oshkosh Area School District, except for Riverside at Fox Valley Tech. Of those, approximately 34% had students in elementary school, 22 in middle school, and 36% had children in high school. About 8% of parent and caretakers selected other in response to which school that their children attended. Students from all grades K through 12 were also represented by parent and caretakers. The following figures demonstrates the percentage of students and parent caretakers that identify with each gender category and the race or ethnicity of participants that they identified with. Parent and caretaker percentages are on the left-hand side of the chart and student percentages are on the right. Notably, the racial and ethnic diversity of students was much greater than the parent and caretakers. For instance, 62% identified as students of color compared to 27% of parent and caretakers who identified as Black, Indigenous, and people of color. When asked if their household had a vehicle to use for transportation, 25% of students said sometimes and 11% said no. Of the parent and caretakers, 18 responded sometimes and 5% said no. It is also important to note that when we look deeper at who the students were that did not have reliable household transportation, 28% ride the bus 6 to 10 times and 33% ride 10 times or more in a week. Thus, adding those two together, it can be said that 61% of students depend on the city bus on a regular and perhaps daily basis. Other studies have shown that immigrants rely on public transportation to a greater extent than native-born residents. We include a reference to this in the written report. This study found that 33% of students and 12% of parent and caretakers had an immigrant or refugee background. Of those students, 31% ride the city bus 6 to 10 times per week, and 22% ride 10 or more times per week. Again, adding those figures together, it can be said that 53% depend on public transportation on a regular daily basis. Focus groups were held to further explore the survey results. Questions were developed by the stakeholder team to understand the impact and challenges. The stakeholder team also collaboratively developed focus group questions. These were informed by the preliminary results of the two surveys. 3 sets of questions were created for focus groups. One set for students who have ridden the GO Transit City bus, another set for students who have not ridden the GO City Transit bus, and a third for parent and caretakers of students who have ridden the GO Transit bus. The stakeholder team was vital to coordinating the student focus groups. One group was held at the Boys and Girls Club of Oshkosh with 6 students who had not ridden the GO Transit City bus. 2 additional student focus groups were coordinated at Merrill Middle School with 11 students in the English to Speakers of Other Languages program. 2 focus groups were also held with 4 parents and caretakers. One in-person focus group was held at the Oshkosh Food Co-op, and the second focus group was held virtually over Zoom. Data analysis was conducted after completion of all focus groups.
All right, so moving forward, we wanted to briefly share with you kind of the 3 key impact areas that really came out of this evaluation. And again, this is expanded upon in the report. But when we look at the students and parent caretakers who responded to the survey, this table shows the percentages that answered in the affirmative regarding how much students were impacted by the GO Transit bus program. Although a main goal of the pilot was to increase student access to school, it really provided other benefits across 3 areas, and that's what we wanted to really identify here. So the first was educational, including school attendance and school activities. The second was focused on health impacts, so related to social activities and healthcare access. And then the third key impact area was financial. So we looked at both job access and money savings for students and their households. So to dig a little deeper here in the educational impacts. So school attendance of 31% of the students surveyed was highly impacted by the GO Transit City bus program, meaning they were able to get to school on time more often. They weren't as stressed out about how they were going to get to school. Those sorts of things were discussed in the survey. And when we look at that 31% of students surveyed, of those, 86% were students of color, 31% were from an immigrant or refugee background, and 46% live in a household without a reliable vehicle for transportation, as Beth was just talking about in her section. In addition to that, we had 40% of our parents and caretakers who reported a very high impact on school attendance for the students that they take care of. Next, when we look at the health impacts, so just to point out here a couple of things. One of the highest impacts that students, 61% of them, and parent caretakers, or 49%, reported was a better ability to take part in social activities. So these activities, it's really critical to think about how they enhance social well-being, which is really vital to youth mental health. So really, it helps reduce isolation and connect people with better opportunities to essentially do things like hang out with their friends or go downtown or go shopping or just essentially be with other people on the city bus. The other thing that was really important here, we found that the city bus program provided the opportunity for students to go and get healthcare products and go and pick up prescriptions and get to medical appointments to a better degree. So 35% of our students shared a high impact in healthcare access. And then finally, in the financial space, so the Go Transit pilot program highly impacted 30% of students' ability to get jobs or go and volunteer or do college campus visits. And this other area that's really important to note is that the greatest impact on both students, so 77% of our students surveyed, and then 75% of parents and caretakers, was the money they saved by using the Go Transit city bus program. This graph shows just another way that we collected data on the impact areas, and it shows our focus group conversations focused in those three areas. Again, health, financial, and educational, which are kind of highlighted here in the red box. So the positive impact most discussed by students in our focus groups was the financial benefit. The parent and caretaker focus groups focused most on health benefits. And then the three other kind of emerging themes that came out of this related to positive impacts were things like how bus drivers had a positive impact on students, kind of looking out for students, how it enhanced safety, so students being able to use the bus rather than walk places. Bus passes were also noted as a positive impact on students. And then our parent and caretaker group also brought up a reduction in traffic congestion. There are additional quotes and analysis that elaborate on these findings, again, in the report that is shared. So again, just touching on this at a very high level, but we did want to share just a few quotes that came from our analysis. So for instance, under the educational impact area, one Oshkosh parent shared, "My kids taking the bus has helped significantly for our family. Dad and mom both work early hours, so it was so nice that our kids didn't have to go to school hours before class and just wait outside. They never had transportation as a reason to miss classes." Moving on to the health impacts. So one student shared, "It's easy to get to Walgreens to pick up my meds and a really easy ride to Walmart to pick up anything else I might need." So again, ability to get more products. And then finally, the financial piece. So one Oshkosh parent shared, "Financially, not only it saves us money, saves time on gas, having to bring the kids to and from school, especially trying to wrangle a job as a single father. I don't know what I'd do without the program." On the other side, we also wanted to get a sense of what some of the challenges were related to accessing the Go Transit City Bus program. So there were three key challenges that we assessed in the surveys. One included bus hours. So about 13% of students and 7% of caretakers said that the bus hours were too limited in terms of maybe not being offered early enough or late enough to get to school and other activities. The second area was focused on bus pass requirements. So there was a new requirement implemented by Go Transit earlier in January of 2023, and that was noted as challenging by about 18% of students and 26% of caretakers in terms of requiring either a paper pass or a digital app that folks with smartphones could utilize. The last area that really stood out as a challenge were safety concerns. So those were described as highly challenging by both 25% of students and parents and caretakers. There's a really important thing to kind of unpack around the safety challenge, because safety was discussed in a lot of different ways by our participants. And so we coded it as safety in regards to things like not just maybe fights on buses between students, but also students who described being uncomfortable with other passengers who may be adults on the city buses, interactions with bus drivers, and things like weather-related issues. So having to maybe walk after missing the bus in really cold temperatures. So safety, again, is discussed in the report in a number of different ways. And the people that participated in our study really talked about it in a number of different ways as well. Our focus groups also focused on challenges. And so much of the part of the conversation where we talked about challenges, that's what's recorded here in this graph. So issues related to the three main impact areas are noted here. So again, if we think about educational, health impacts and financial impacts, so there weren't really many things related to challenges around educational and health, a little bit more in terms of financial. The other things that really emerged out of our focus groups here were themes related to things like challenges with bus drivers, lack of bus cleanliness, and even parents not allowing their students to ride GO Transit as a barrier to access. Again, I just want to clarify, this only relates to the part of the focus group where our team really discussed challenges specifically. So the most discussed challenge by students was related to safety concerns, about 61%, followed by bus hours being too limited, and then challenges with bus drivers. On the other hand, if we look at the blue components here on the chart, the parent caretaker focus groups also largely focused on safety concerns, followed by bus hours, and then those being reported at about 31% of a challenge for the students of parents and caretakers. And again, there's further analysis of this in the report, but this just gives a sense of what we were finding overall. In terms of just summarizing our findings, we want to highlight that really the impacts of the GO Transit City Bus program for K-12 students in Oshkosh reached beyond simply a ride to school. So Beth, do you want to pop on here and go through your three main areas? I'll move our videos over here together.
Thank you, Sam. So despite a slow start to the GO Transit City Bus program in the spring of 2020 due to COVID-19, student ridership has significantly increased each year since that point, requiring additional buses to added to meet service demands in some instances. The original aim of the pilot program was to increase student access to school. However, many additional impacts related to the access to healthcare, social well-being, and community connection to other services was expressed by survey and focus group participants. Greater access to work opportunities and financial savings have also resulted. In fact, financial savings was the biggest or the highest reported impact by students, parents, and caretakers.
Thanks, Beth. And then just moving forward, we want to highlight again how these impacts have been especially significant for students and households from historically marginalized groups. And we touched on this before, but students of color, those from an immigrant or refugee background, and those living in a household without a reliable vehicle for transportation, those were truly the people that were most impacted by providing a no-cost option to not just school, but to many other types of establishments and activities. We also found some of the key challenges to accessing the GO Transit City Bus program for students related to things like bus hours and bus pass requirements. And even though those were discussed, they were actually quite minimal. And we also know that in working with GO Transit, they are working on trying to reduce some of those barriers. But we would highlight, and this is highlighted in the report as well, that there needs to be ongoing work with GO Transit, and then also even with the bus drivers whose voices were not included in this, but are a critical component of a program like this. So moving forward, one of our many recommendations that folks can find are, connecting with bus drivers and getting a better sense from them of some of the challenges and opportunities related to this program. The last thing that we just want to share and highlight again is that safety was noted as the greatest challenge by both parent, caretakers, and students. But it's really important that safety was also cited as a positive outcome of the no-cost GO Transit City Bus program. So we see this especially when folks are talking about how riding the bus is much safer than, walking places, especially when there's harsh weather outside. So that's one of the other areas that we recommend in the future to kind of unpack a little bit more, to think through both the positive and kind of challenged areas of safety. But overall, these are the key pieces. Please see the report for more information. And we just thank you for watching this today. And I want to say thanks again to Beth for walking through the presentation again with me. Thank you all very much.